Hello and welcome. My name is Dr. Michael Lavender and I'm a clinical psychologist working in the bariatric service. Now, a lot of people come to see me feeling really anxious and nervous, and that's because they just don't know what psychology is all about and what psychologists do. So I'm here to tell you a little bit about medical health psychology and where we fit into your bariatric journey. My role is to assess your readiness and suitability for bariatric surgery from a psychological perspective. And if any member of the bariatric team identifies any psychological need or past difficulties with mental health, you may be asked to meet with me or one of the psychology team. We want to make sure you have the best possible outcome from your surgery, and identifying psychological difficulties before surgery can help us predict if any problems may come up, and we can help support you with this. So usually we'll have a discussion about any mental health diagnoses you may have or current stress you may be experiencing. We will talk about any difficulties you've had in the past and how they may be impacting on you in the here and now. And we'll also look at areas of risk, such as suicidal thoughts and forms of deliberate self-harm. Occasionally there may be times when we think you may benefit from additional psychological support for your mental health. At these times we'll help you find the right support that you need in the right time, so that we can reassess you at a future date, and hopefully at that point you're in a better position to continue with your bariatric surgery. If this is needed, we'll talk it all through with you so you can be involved in any decisions. We'll also talk a bit about your eating habits. So using food to manage our emotions is a typical coping mechanism for a lot of people. However, after surgery that becomes a lot harder to do, and research and our own experience shows that these type of people often struggle post-surgery. So it'll be important for us to think about how you can move away from using food to cope and use more helpful strategies like mindfulness, relaxation, distraction and thought challenging. We will then talk about the surgery itself and your thoughts on this. Some people are understandably worried about having surgery, and they might need a little help with relaxation and anxiety management to help them prepare for this. Other people may have worries about how their body will look after surgery, and we can support you with all these aspects of your bariatric journey and signpost you to local free services if needed and if we can't support you. In most cases, no. The assessment is really for your benefit, to see how much your mental health condition impacts on your daily life, your ability to sustain healthy eating patterns, and to be able to hear this after surgery. It's a chance for us to get you any help you need and support you need, and to make sure you have the best possible outcome from your surgery. This normally doesn't delay surgery. However, if people are currently struggling to cope because of a mental health condition, past trauma or abuse, then there may be sometimes we recommend some additional psychological support, and that this happens before the surgery goes ahead. If this is needed, we'll give you clear direction and guidance on what to do, and we'll suggest you that you go to the right places. If it's not possible to do that work with you, we can signpost you to free services in the local area to do that work. After that work is complete, we'll reassess things, and then hopefully you're in a better position to go ahead with your surgery at that time. Yes, our psychology service is open to you for up to 2 years post-surgery. If you find you have any psychological difficulties after your surgery, any body image concerns, anxieties around eating for example, then please just get in touch with the team and we can arrange to discuss your concerns. We also run a bariatric body image support group as well as a post-surgery support forum.